Recognizing the silent threat, 10 warning signs of stroke. A stroke, often referred to as a brain attack, is a medical emergency that occurs when there is a sudden disruption of blood flow to the brain. This interruption deprives brain cells of oxygen and nutrients, leading to the rapid death of these cells. Strokes are a significant health concern worldwide, ranking as one of the leading causes of disability and death. Understanding the warning signs of a stroke is crucial, as prompt recognition and action can make a substantial difference in the outcome and quality of life for the affected individual. The impact of strokes extends far beyond the immediate health crisis they present. Strokes can result in long-term disability, affecting a person's ability to move, speak, and even think. Additionally, strokes can have a profound emotional and financial impact on both individuals and their families. Therefore, raising awareness about the warning signs of a stroke is paramount to fostering a culture of early detection, which can significantly enhance the effectiveness of treatment and improve overall outcomes. Now, let's delve into the specific warning signs of a stroke that everyone should be aware of. 1. Sudden weakness or numbness. One of the hallmark signs of a stroke is the sudden onset of weakness or numbness, typically on one side of the body. This may affect the face, arm, or leg, and is often accompanied by a feeling of heaviness or difficulty moving the affected limb. If you or someone you know experiences sudden weakness or numbness, especially on one side of the body, it is crucial to seek medical attention immediately. 2. Confusion and trouble speaking. Another warning sign of a stroke involves sudden confusion, difficulty speaking, or slurred speech. A person experiencing a stroke may have trouble understanding others or expressing themselves coherently. If you notice sudden changes in speech or witness someone struggling to communicate effectively, it is essential to consider the possibility of a stroke and seek emergency medical assistance. 3. Severe headache. A sudden and severe headache, often described as the worst headache of one's life, can be a warning sign of a stroke. This headache may be accompanied by other symptoms, such as nausea, vomiting, or sensitivity to light. While headaches can have various causes, the abrupt onset of an intense headache should not be ignored, as it could indicate a medical emergency like a stroke. 4. Trouble seeing in one or both eyes. Vision problems can also be indicative of a stroke. Sudden blurred vision, double vision, or a loss of vision in one or both eyes may occur. Some individuals may experience a darkening or dimming of vision. If you or someone else is having difficulty seeing clearly, especially in conjunction with other symptoms, it is crucial to seek immediate medical attention. 5. Dizziness and loss of balance. Feeling suddenly dizzy, unsteady, or experiencing a loss of balance and coordination can be warning signs of a stroke. Individuals having a stroke may struggle to walk or maintain their balance, potentially leading to falls. If you observe someone exhibiting these symptoms, it is essential to treat it as a medical emergency and seek help promptly. 6. Facial drooping. Facial drooping, especially on one side, is a classic sign of a stroke. If you notice that one side of the face is drooping, or if the person is unable to smile symmetrically, it could be an indication of a stroke. This occurs due to the weakening of the facial muscles on one side, and immediate medical attention is necessary to evaluate and address the underlying cause. 7. Difficulty swallowing. Difficulty swallowing, also known as dysphagia, can be a warning sign of a stroke. This may manifest as a sensation of food getting stuck in the throat or difficulty coordinating the muscles involved in swallowing. If someone experiences sudden difficulty swallowing, it should not be dismissed, as it could be a symptom of a stroke or another serious medical condition. 8. A sudden change in mental status. A stroke can impact cognitive functions, leading to a sudden change in mental status. This may include confusion, disorientation, or even a loss of consciousness. If you notice abrupt changes in a person's mental state, it is crucial to consider the possibility of a stroke and seek immediate medical attention. 9. Difficulty walking. The sudden onset of difficulty walking, termed as ataxia, can be a warning sign of a stroke. This may involve stumbling, lack of coordination, or a feeling of unsteadiness. If someone is struggling to walk or experiencing a sudden change in their ability to move, it is essential to treat it as a medical emergency and seek prompt medical evaluation. 10. Transient ischemic attack, TIA, or mini-stroke. Sometimes referred to as a mini-stroke, a transient ischemic attack, TIA, is a temporary disruption of blood flow to the brain that mimics the symptoms of a full-blown stroke. While TIAs typically resolve on their own, they serve as crucial warning signs that should not be ignored. Individuals who experience a TIA are at an increased risk of having a more severe stroke in the future. Recognizing and addressing TIAs promptly can help prevent a more significant stroke from occurring. Early detection is a cornerstone in the management of stroke, and it plays a pivotal role in minimizing the damage caused by this life-threatening event. Time is of the essence when dealing with a stroke, as the brain's sensitivity to oxygen deprivation means that every minute counts. Rapid intervention can prevent or limit brain damage, making the difference between a full recovery and lifelong disability. By recognizing the warning signs of a stroke and seeking immediate medical attention, individuals can pave the way for timely treatment options such as clot-busting medications or mechanical thrombectomy, both of which have been shown to significantly improve outcomes. In essence, the key to combating the devastating effects of a stroke lies in the hands of those who can identify the warning signs and take swift action. In conclusion, being aware of the warning signs of a stroke is vital for both individuals and the community at large. The significance of early detection cannot be overstated, as it directly influences the effectiveness of treatment and the long-term outcomes for stroke survivors. By familiarizing ourselves with these warning signs and understanding the urgency they demand, we can contribute to a culture of swift action and improved stroke care. Now, let's delve into the mnemonic that simplifies the recognition of stroke symptoms. FAST acronym: face drooping, arm weakness, speech difficulty, time to call emergency. FAST serves as a quick and easy way to remember and identify the most common signs of a stroke. Face drooping. Check if one side of the face is drooping or if the person is unable to smile symmetrically. Arm weakness. Assess whether there is weakness or numbness in one arm, as the person may have difficulty raising both arms evenly. Speech difficulty. Listen for slurred or garbled speech. If the person has trouble speaking or is unable to articulate clearly, it could be a sign of a stroke. Time to call emergency. Time is of the essence in stroke care. If any of these symptoms are present, call emergency services immediately. Every minute counts, and prompt action can make a significant difference in the outcome. Certain factors, including age, with a higher risk for those over 65, family history, hypertension, smoking, and diabetes, significantly increase the likelihood of experiencing a stroke. Regular monitoring and management of these risk factors are essential for stroke prevention. But taking proactive steps to address these risk factors can significantly reduce the likelihood of experiencing a stroke. Lifestyle modifications and health management are key components of stroke prevention. Regular health checkups. Schedule regular checkups to monitor blood pressure, cholesterol levels, and overall cardiovascular health. Quit smoking. If you smoke, quitting is one of the most impactful changes you can make for your health. Seek support from healthcare professionals or smoking cessation programs. Healthy diet. Adopting a diet rich in fruits, vegetables, whole grains, and lean proteins can contribute to overall cardiovascular health. Regular exercise. Engage in regular physical activity, aiming for at least 150 minutes of moderate intensity exercise per week. This can help maintain a healthy weight and promote cardiovascular fitness. Stress management. Chronic stress can contribute to hypertension and other risk factors for stroke. Incorporate stress-reducing activities such as meditation, yoga, or hobbies into your routine. In conclusion, stroke awareness and prevention are fundamental aspects of maintaining a healthy community. By recognizing the warning signs, understanding the FAST acronym, and addressing common risk factors through lifestyle changes, we can collectively work towards reducing the impact of strokes on individuals and families. If you found this information valuable, please consider giving it a thumbs up and sharing it with your friends and family. Knowledge is a powerful tool in the fight against strokes, and by spreading awareness, you can play a vital role in saving lives. Remember to subscribe for more health-related content, and don't forget to hit the notification bell to stay updated on our latest videos. Stay healthy, stay informed, and we'll see you in the next video.